In terms of advice for daily living, maybe the three biggest things are good sleep, lots of good activity during the day, and talk to your doctor about the risks so that you have a real rational viewpoint on them. Sleep meaning two things, like getting enough sleep, but also keeping a very regular sleep schedule ends up being very important for good seizure control. And I feel like what I've seen is that if the sleep cycle is enough, sleep and pretty regular, then you can minimize the amount of treatments that you need to be exposed to. I really like to encourage children to be as physically active as possible, because then they're going to sleep better and it's good for their health and to be outside and their bone health and everything. So that's really important. What I've seen is often when families are first confronted with this knowledge that their child has epilepsy, they tend, like all of us, tend to be overprotective. But I think that's totally natural. And what often happens is then once things get better controlled, say over 3 months or 6 months, and that can relax and the vigilance can relax. So I think it's normal to be more attentive, particularly until you're assured that things are going well and the treatments are working well. Talk to your doctor about the risks of epilepsy, all the risks of epilepsy, like what are the risks of injury or SUDEP, which is sudden unexpected death in epilepsy. I know it's a tricky, it's how to bring that up, but I think if you bring it up in the context of, doctor, or your nurse practitioner, what are the risks of epilepsy? So you can have a frank discussion about these things and then put it into context so that you can fashion what will be your strategy for how you're going to keep some surveillance over your child and what types of restrictions, if any, are appropriate. You are not alone. There is a huge community of people that are there that would want to support you.